All right, good morning again. Everybody doing all right this morning? Thank you for bearing with us for the accommodations here. Appreciate it. So, welcome. I am Jen Nelson. I am a senior advocate at UnitedHealthcare, and I will be talking to you today about the state's Heritage Health Program. We're going to focus on the new Heritage Health Program, the state's integrated managed care program. We have several presenters this morning representing each health plan. So first, I am going to do a brief presentation regarding the Heritage Health and what it means for our members going forward, as well as the providers. After this brief overview, each of the health plans will present their information. In between each of the health plans' presentations, we'll take a short 2-minute break to set up for each presentation. At the end of each of the presentations, we will have a Q&A open forum for you to ask your questions. Today's session is being recorded and will be added to the state website to allow those not able to attend an opportunity to view the information. Managed care is a system of healthcare delivery in which the state contracts with MCOs or health plans to administer the benefits and services for their members. In a traditional fee-for-service state-administered program, the state is responsible for contracting with the healthcare providers that are delivering the services and receiving the claims for them, processing them, and paying them. But depending on the level of utilization, their level of cost can be somewhat unpredictable. With managed care, the state uses a capitated model in which the state makes a fixed monthly payment to the MCOs, and they are then responsible for managing that provider network and paying those claims. The monthly payments are adjusted based on the level that the individual needs, where they live, and also the relative level of risk of their health. This creates more budget predictability for the state in that the state can kind of forecast their needs for the budget. They will also be able to look at the enrollment trends and predict how much the state is going to be paying each month to the health plan for those services. Those fixed rates are developed by their actuaries. They look at the trend of healthcare costs. They look nationally at what trends are coming in terms of healthcare expenditures, and they develop rates that are designed to be inclusive of the healthcare services. The managed care system also improves efficiency over fee-for-service as the health plans tend to be better equipped and better able to manage the utilization. They can do coordination and help lower costs by reducing some of the more costly care like emergency rooms and hospitalizations. Medicaid and long-term care has now entered into contracts with 3 health plans. You have Nebraska Total Care, or Centene, UnitedHealthcare Community Plan of Nebraska, and WellCare of Nebraska. Each of these plans will operate statewide and provide integrated health services, which include physical health, behavioral health, pharmacy services to enrollees beginning January 1st of 2017. The state is working diligently to make this transition, including readiness, provider education, claim and enrollment periods, for the members to select and enroll in their plan, and to make sure that the provider networks are prepared for this transition. Here are some tools to help providers obtain eligibility information for their patients. You're probably all familiar with the NEMS, the IVR. So then you have the web and the HIPAA. From December 7th through December 31st of 2016, the eligibility verification tools will show the client as Medicaid eligible and enrolled in current physical and or behavioral health. Information for the Heritage Health enrollment for January 1st of 2017 will not be available because the enrollment won't be finalized. However, as of January 1st, 2017 and ongoing, Heritage Health managed care enrollments, including pharmacy benefit manager, for each MCO will be available in the verification tools. The state has contracted with automated health systems to provide enrollment broker services. This is a key principle for Heritage Health as it's the member's choice. AHS will provide member outreach and support during the open enrollment period to help individuals determine which health plan will best meet their needs. Their contract includes letters alerting the members of open enrollment periods, phone calls to provide any necessary counseling as they review their options, and also searchable databases for the primary care providers. For more information about Heritage Health, please visit the state website. You can email them with any questions. In addition, you can find them on Facebook, and you can also follow them on Twitter. Next, I'm going to pull up the UnitedHealthcare presentation. Each of you should have received a presentation from each of the MCOs when you registered this morning. Hopefully everyone has a copy of each of the presentations. If not, please let us know and we can email those out to you. In addition to that, if you need additional copies, we can also get those emailed out to you as well. Our mission at UnitedHealthcare is to help people live healthier lives. Our vision is to provide health plans that meet the needs of our members and be the most trusted name in healthcare. Our role is to make healthcare work for everyone by building trust and demonstrating excellence in everything we do. UnitedHealthcare is not new to Nebraska. We've been operational since 1984, covering more than 425,000 individuals. We have more than 312 employees in the Nebraska market, and we are continuing to grow. The United Community Plan of Nebraska started in eastern Nebraska in 1996 with 3 counties, and we added 7 more in 2010. So most of you in this room probably are already familiar with UnitedHealthcare's community plan. And the only changes that we're making is adding behavioral health and pharmacy. So, as of January 1st of 2017, we will be present in all 93 counties in Nebraska. In addition, we've been accredited by the NCQA since 2005, and Nebraska is currently rated at 4 stars. The managed care plans will be responsible for the same benefits and services, including physical health, behavioral health, pharmacy, transplant, telehealth, and telemental. The managed care plans will not be responsible for dental services, institutional long-term care, nursing facilities, services at a custodial level of care, school-based services, home and community-based service waiver services, but they will coordinate with case managers to facilitate the care, targeted case management services, Medicaid state plan personal assistance services, and non-emergency transportation services. This is a copy of the community plan's ID card. So on the front of the card, it does indicate that it is UnitedHealthcare Community Plan. Has the member's ID, the member name, a Medicaid number, the PCP name and phone number, the RX VIN number, group number, and PCN. And on the back of the card, it includes the claim submission information. Our payer ID has not changed, therefore it is the same. We do prefer you to use the UnitedHealthcare member ID. However, you can submit by using the Medicaid ID number. So I know that's an important piece for y'all. To verify member eligibility and benefits, you can access the link portal at UnitedHealthcareOnline.com. You can contact provider services, which we will have an office in Omaha, so it will be local. You can also utilize the Heritage Health NEMS IVR system. Next, I will turn it over to our behavioral health representative, Tracy, and she will talk to you about the behavioral health piece.
Good morning. My name is Tracy Gandera Moore, and I am the Nebraska Network Manager and Provider Relations Advocate for ACTA. I'd like to introduce you to the Whole Person Care team clinical model and care management process. This is an exciting process that really promotes our ability to achieve our goal of integrating behavioral, medical, and pharmacy for all members while interweaving a greater level of integration for those who need it. This is a member-centric model, so there will only be one leader for the care management team, so just one single point of contact for members. We will also have the ability to flex in different peer supports, community health workers, and care advocates will function as a liaison to provide in the communities such as primary care, behavioral health clinicians, and others. The goal is to help provide connection as well as coordination and strengthen relationships so that members sees the appropriate people at the appropriate times and also has an integrated care plan. The Care Navigator functions as the single point of contact for members with complex behavioral health, physical health, and comorbid conditions to connect them to needed services and resources. They also collaborate and partner with individuals in the development of a comprehensive care plan to include therapeutic services, community, and psychosocial supports such as education and employment assistance, peer support, legal services, and basic needs. The Care Navigator will help coordinate resources between behavioral health and physical health providers. The role of the Recovery and Resiliency Team is one of the key components of the care management model. It gives the member the opportunity to have a recovery and resiliency team to include peer support specialists as well as a recovery and resiliency manager. The lived experience that the peer support specialist as well as the recovery and resiliency manager brings to the table benefits members in their ability to relate, coordinate, and navigate this system. This has proven to be extremely helpful to members in the overall process. Having someone individuals can relate to is an important element and essential piece of overall well-being and care management for the members. Community Care is an online care planning tool that members and the service coordination team can both access. It provides real-time information to assist with members' coordination of care. Accessible information includes care plans, authorization requests, medications, test results, and other information to assist with members' care coordination.
Thank you, Tracy. Our prior authorization information can be found online at uhccommunityplan.com. To conduct a prior authorization, you can utilize the link portal or you can call our prior authorization line. We've included a sample list of services that do require pre-authorization. Please note that this is not an all-inclusive list. Again, for those lists, you can visit our website or you can call in and get more information. For the appeals process, providers can appeal within 90 days by calling in or writing and providing all necessary documentation. There's also an expedited appeal decision process if needed. I'm sure you're all quite familiar with how to submit a claim, but the claim process, you can submit it electronically through our link portal or via paper. Again, we have the same payer ID. For electronic payments and statements, also known as EPS, this will allow you to receive EFT payments and EOBs electronically. If you are interested in signing up and are not currently signed up with it, please visit our website, UnitedHealthcareOnline.com, or call our EPS team. Claim reconsiderations. Administrative appeal is for any payment decision after services are rendered. Reconsiderations can be mailed in. They can also be completed on our link portal. Appeals should include the reason for the denial and all relevant documentation to support that claim. This must be filed within the time frame specified in your contract. For claim adjustments, you can find the reconsideration form online, file that through the link portal, or you can call our customer service. For credentialing and contracting, most of you should already be contracted with us, if not all of you. However, if you do have specific questions regarding any credentialing or contracting needs, please feel free to contact us. You have the information for physical health, behavioral health, and the pharmacy information. Our provider advocates are an important resource to you. They will assist you with all lines of business, providing you with educational tools and resources. And in addition, they will work to build and maintain an exceptional business relationship. If you are not familiar with who your advocate is, please reach out to us and we will help you identify who that is. For our service model, utilize our self-service options through UnitedHealthcareOnline.com, or you can also call into customer care. If you are not getting resolution or you're not getting your needs met through those pieces, and please utilize those pieces first, then that's when you would reach out to your provider advocate. That's why it's extremely important for you to know who your advocate is, so that if you are struggling with some issues, then you can reach out to your advocate and they can help you. For online provider resources, again, we talk about our link portal. This is accessible at UnitedHealthcareOnline.com. You will sign in with your Optum ID. If you're not sure if you are signed up for this, again, please let your advocate know and we can provide training for you and also get you help set up with that. You can also have an online resource at uhccommunityplan.com where you can access the provider manual, provider newsletters, and the reimbursement policies. In addition, you can also access UnitedHealthcare Online application. The link portal offers you the opportunity to view eligibility and benefits, claims management, conduct those claim reconsiderations, also view EPS and gaps in care. When you log into the link portal, this is what your home page is probably currently looking like. We are making changes to this portal, and we are increasing the technology here. But this is probably what most of you are viewing at this time. So you can see at the top we have United Healthcare eligibility and benefits. So all of these different pieces are called applications or tiles. So you can click on each piece and view information about that particular area. So you can see we also have the community plan, and then again we have claim reconsiderations, claim management. If we click on United Healthcare eligibility and benefits, it opens a separate window displaying the member's information. So you can see the demographic information, the member ID, as well as the plan that the patient is on, and if they have any, if UHC is primary or if they have a secondary insurance as well. To learn more about the link portal, please go to UnitedHealthcareOnline.com. Again, get with your advocate to schedule additional training for you and your staff to become more knowledgeable with our link portal so that we can help you out with these tools and online resources. In addition to communication tools, we also provide the provider manual, which includes information regarding claims, benefits, prior authorizations. This is accessible at uhccommunityplan.com. We also have the Practice Matters newsletter, which is a quarterly specific publication. Again, it's accessible at uhccommunityplan.com. We also have the Network Bulletin, which is our monthly newsletter. The new one for November, right? November's tomorrow already, I think. So the new one for tomorrow comes out because they come out on the first of every month. If you are not subscribed to this, I would highly encourage you to subscribe to our newsletter. This will give you policy updates, reimbursement updates as well. You can find this as well as the link to get set up for this bulletin at UnitedHealthcareOnline.com. Again, this is also something that your advocates can help you with, So if you're not currently signed up for that newsletter, please reach out to one of your advocates and let us know so we can help you get set up with that. Pharmacy contracting, you can contact them via phone, email, or online. For credentialing questions, you can contact them by phone or email. MAC questions are also phone and email. DME, phone, email, or visit UnitedHealthcareOnline.com. PDL and prior authorizations. The preferred drug list requires prior authorization on certain medications. Pharmacies receive notification of prior authorizations and edit requirements via the pharmacy point-of-sale messaging. Prior authorization requests can be submitted via phone, fax, or through the link portal. Decisions made within 24 hours once received are communicated to both the member and the prescriber. Medication therapy management. This MTM helps members adhere to their medication regimen and promotes PDL and therapy management adherence. Retail pharmacy engagement to provide MTM services is an important part of United's quality program. Pharmacists will be credentialed and will receive payment based on their services. In the pharmacy information here, we've included the BIN number, the PCN number, the group information. And for claims assistance, please contact the claims department via phone. They are open 24 hours a day, 7 days a week. For the pharmacy online resources, you can access that at uhccommunityplan.com. This will house both the PDL and the formulary information. Additionally, you can find the drug lookup tool, prior authorization forms, the clinical criteria, prescriber reference guide, and many other pieces of information. Next, I'd like to talk to you about our value-added services through the UHC Community Plan. To encourage our members to visit their well-visit exams, we have waived their co-pays on covered services. Therefore, there's a zero copay. We want to promote healthy habits and self-care by providing coverage for adult physicals. Our Baby Blocks program keeps the mom-to-be and the baby healthy during pregnancy and the baby's first 15 months by rewarding them to attend appointments. Those rewards can include diaper bags or gift cards. Members who enroll early can earn up to 8 rewards. Our Healthy First Steps ensures that mom and baby will get good medical attention and supplies, including breast pumps. These member engagement programs, like Baby Blocks, support expectant mothers and new parents with customized wellness tips, information about what to expect at provider visits, and rewards them for completing appointments during the baby's first 15 months. We also have community baby showers. This educates them on prenatal and postpartum care while also rewarding them. We have community health workers that connect with our members and help educate them on resources they need to get the care they deserve. They also help members overcome some social barriers. We have a mascot called Dr. Healthy Hound, who delivers nutritional and education and promotes fitness and healthy habits. We have key national partners with Sesame Street and the National 4-H Council to help educate members on healthy habits and good nutrition. Health for Me app allows the member to access information on the go. They can pull up their ID card, view providers, and also check transportation in the area. Advocate for Me assists members with their needs and engages in additional items to benefit their health. An example would be to identify who their PCP is or identifying the gaps in care. We also have a 24-hour nurse crisis and nurse line to handle medical questions and situations for members 24 hours a day, 7 days a week. Outreach initiatives such as 4-H Food Smart Families are helping families make healthier habits a greater part of their everyday life. Through these and other quality improvements and investments, we are continuing to make the healthcare experience more personable and accessible and, most importantly, affordable. The last slide contains additional information for contacts in various areas of our company. Feel free to utilize that as needed. I apologize for the communication or the technical difficulties this morning and the room accommodations, but I do thank you for coming today. We're going to take a couple minutes to get set up for our next presenter. So feel free to get another drink, another pastry. Facilities are out this hall to the left if you're needing facilities. So thank you so much for attending today.
I still have to do reports by some other way because they didn't have advertisements like ATVs. This is 72 hours.
Good morning again. My name is Monica Johnson, and I'm the manager of network development for behavioral health at Nebraska Total Care. And I appreciate all of you, and I mean all of you, coming out this morning to hear about Nebraska Total Care and what we will be doing for both providers and for our members. So, as an overview, our parent company is Centene Corporation, based out of St. Louis, Missouri, and Centene began in 1984. While we're certainly new to Nebraska, we are not new to Medicaid. We offer Medicaid, Medicare, and Better, our exchange program, in 28 states. 24 of those are Medicaid, 15 states we offer exchange, 2 international markets, and we are serving 11.5 million members worldwide. Our philosophy is a local approach. Our approach is local. So that really means that we are providing health care services for individuals in Nebraska by hiring individuals as well from Nebraska. So, for example, myself, I'm born and raised here in Omaha and have spent my entire career in serving Nebraska. As we are working together to use a coordinated care model, we are also integrating that care model through our proprietary care management programs. So we're really looking at making sure that members receive the right care at the right place at the right time. Our healthcare compliance, we're really data-driven, and so we'll be sharing with you information, analytics about how your organization is doing, how your membership is doing, any care gaps that we identify through those analytics, and we'll talk a little bit more about those further in the presentation. And because we are a local approach, we're able to address some of those cultural issues related to our membership. So whether that's bridging social, ethnic, or economic gaps, we'll be working with you in collaboration with your care managers, with your case managers, with your PCP, in order to ensure that if we need to get somebody out to that appointment, then our staff will be working with you, knocking on doors, making phone calls, working on those reminders. So our goals are, one, to link members to the medical home that is best able to serve them. So providing that local infrastructure within Nebraska Total Care, you can expect to be working with case management, connections representatives, so those individuals who will be working intimately probably with your case managers, disease management programs that we'll talk a little bit about, our call center, which is local and located in Omaha, our professionals that across the area that really understand claims, that are working to be able to, for example, triage any concerns or questions that you may have. Member services, provider relations, and provider services. So we're really looking to work with you to increase primary care and to reduce and unnecessary emergency room visits. And we're looking to increase EPS-DT screenings, prenatal postpartum care, and diabetes rates to improve those individuals' lives and quality of lives for our membership. So identifying and facilitating treatment for secondary conditions, really again that integrated approach, coordinating care to reduce duplication and waste, reducing socioeconomic barriers to care, and implementing physician-driven strategies. Our goal again is to support the PCP and the healthcare plan that you are outlining for those members that you are serving. So an overview of Nebraska Total Care is, at a minimum, we'll be covering those core benefits that are defined by Nebraska DHHS, physical and behavioral health needs of the members residing within the facilities, pharmacy services, vision services for routine medical services and glasses, All services are subject to benefit coverage limitations and exclusions as described in the applicable plan coverage. So the Nebraska Total Care ID card. When you are working with a Nebraska Total Care member, this is the ID card that you will expect to see. I want to point out two things on the card. The first is that the member ID number will be the same as the Medicaid ID number. The second is that we will be having one payer ID number located in the box to the right, and that is 68069. That will be for both physical health and for behavioral health. Website and web-based tools. If you go to nebraskatotalcare.com, this is the website image that you will see. And what you will expect to see as we are moving closer to go live, closer to that January 1st, 2017 deadline, is one, provider information for medical services, our provider manual, which is already posted and loaded, our billing manual, our provider authorization code checker. So you'll be able to actually enter in the CPT code and be able to see whether or not that service is authorized. So we'll go through a couple of analytics and yes/no questions, and you'll be able to print that out if you are so interested in doing that, or you'll be able to move forward with the services. Operational forms such as prior authorization forms, notification of pregnancy forms, all of those forms will be available to you. Clinical practice guidelines, provider newsletters, announcements, bulletins, plan news, and find a provider, again, will all be located on our www.nebraskatotalcare.com. We are committed to enhancing this website, so if there are things that as you're working and you think, gosh, that would be great if you would add this, or if we could have an enhancement here, please let us know, and we'd be happy to take that back for consideration. Some of these elements will be, again, added by December 1st. So starting on December 1st, providers are able to enroll into the provider portal. It's free, and it's actually very easy to utilize. So I would encourage you all on December 1st or thereabouts to enter and to begin entering your name and your agency into our provider portal. And what you'll be able to do within that secure portal is member eligibility and patient listings specific to your organization, healthcare records and gaps. You'll be able to see your authorization, claim submission and status. You are able to submit claims to us through our free portal. Corrected claims and adjustments. You are able to correct your claims online for free. And your payment history. So again, while all of these functionalities, for example, will not be available on December 1st, there won't be any claims data in there. There will certainly be an opportunity for you to get that off of your list of things to do. Some examples of reports that you are able to export are, for example, PCPs, your patient list with items and care gaps, emergency renewalization, prescription claim report, lab history, and immunization history. The lists that you see are those electronic data interchange that we work with. So those EDIs are not comprehensive. If you see an EDI that you're working with that is not listed, the information, for more information below, you are certainly welcome to call them to confirm. Again, our Nebraska Total Care ID number is 98069. And we do encourage, if you are not working with an EDI, you are certainly welcome to submit claims for free using the Nebraska Total Care website. For utilization management, you are able to use, again, that website for your authorization tool. You're able to see if there are required services. There will be some required services that require pre-authorization or pre-certification. And we will also have a covered service list online of those items. You will also have inpatient, including submission of clinical criteria that will be available to you. Telephonic options directly to the prior authorization team is certainly available to you. We will have dedicated fax lines to specific roles, for example, concurrent reviews, nurse, behavioral health, etc. And of course, there's always, again, that provider portal that you're able to register on for December 1st. and that will determine what requires pre-authorization. For behavioral health utilization management, psychotropic medication utilization review, that process is also outlined and spoken to in the provider handbook. And it includes pharmacy claim review, medical records review, and peer-to-peer consultation and education. And again, for those behavioral health providers out there, you are welcome to utilize the pre-authorization tool on the website. For imaging and authorization, NIA is the Nebraska Total Care vendor, and starting January 1st, 2017, this outlines those procedures requiring pre-authorization and those excluded from the NIA program. The second slide outlines the NIA's prior authorization review. Starts with an ordering physician moving to either submitting it by request or through radmd.com. And then it provides those evaluations for authorization, services authorized, moves to a rendering provider to service that, and then for the claim. This next slide really outlines a little bit more detail related to the intake level, initial clinical review, and physician clinical review. I do want to note that a peer-to-peer discussion is always available to you. For provider tools, there's a toll-free authorization and information hotline that is available to you from 7 a.m. until 7 p.m. Central Standard Time. There's also interactive voice response, so those systems are able to assist you. RadMD website is available 24/7. You can request authorizations for ordering providers only, review authorization status, upload your clinical information, view clinical guidelines, frequently asked questions. For PT, OT, and ST, Nebraska Total Care has a clinical trainer that will be working with those providers in conjunction with provider relations from the physical health side. So they'll be coming out to you in short order if you haven't heard from them in order to provide you a much more detailed training. But broadly speaking, for PT, OT, and ST authorizations, that information is below. It's required for all outpatient and home health physical for PT, OT, and ST services. And below that, you can also see the documentation requirements for authorization. It is, all requests must meet medical necessity to obtain an authorization. So again, as we get closer to that January 1st timeline, there will be in-depth training for your organizations that are rendering PT, OT, and ST. For pharmacy benefit manager, NPC uses Involved Pharmacy Services. That is actually a Centene subsidiary, wholly owned subsidiary. And so the pharmacy overview, obviously there will be a PDL with state utilization management edits, quantity, prior authorization steps, and NTC will wrap PDL with a formulary for therapy classes not covered. NTC is working with program edits to comply with the Nebraska Medicaid Psychotropic Drug and Youth Initiative. And we're also working with large providers for pharmacy as well as local pharmacy vendors. So we'll have a robust pharmacy network in order for your organizations and for our members to access. There's also a specialty drug contract that is currently under review by the state. As I mentioned before, we're going to have a medication therapy management program, and we'll really be collaborating with those pharmacy vendors. DHHS is to define those 90-day transition periods for members to continue on their current therapy. So as more information becomes available, we will certainly make that available to you. So Vision Services Involved Benefit Option, again, another involved company, which is a wholly owned subsidiary of our parent company, Centene. So Involved Vision Benefits is an eye care administrator with over 30 years of experience in the market. They cover over 7 million lives in 22 states and Puerto Rico. So there is a wealth of information and knowledge that they have in working with the Medicaid product. Prior authorization is not required for any of the services that Involved Vision administers. There is something to note on this slide. Their payer ID number is 56190. And you are welcome to visit the online portal at the web link listed. You're also able to mail claims to the PO Box 7548 or to access the online portal. If you have any questions about joining, if you are a vision provider, please call that 1-800 number and they will be happy to work with you. For care management, again, we are an integrated care model, so we recognize that our members often have comorbidities. So we have people who have, for example, are working with their psychiatrist and may also have some additional issues, whether that's diabetes or cancer, whatever those items are. We're really going to be able to have an integrated team of licensed mental health professionals, social workers, registered nurses, case managers, utilization managers, social workers, and non-clinical staff working to look at what the plan is and how do we further that CCP plan. Our other piece to that is we're going to be educating members on the importance of treatment compliance, helping members obtain additional needed services identified by your offices, and assist in coordination of covered services, community services, and other non-community services, so those community resources. As I mentioned, we have an integrated team approach that ensures physical and behavioral health needs are being effectively addressed. So that may mean that we solicit an multidisciplinary team in order to address those comorbidities. So we'll really be reaching out to your organization, and you should be reaching out to us as well, so that we are ensuring that their needs are being met. We also want to make sure that we employ a holistic and coordinated approach, that we are addressing the needs as well as the barriers to each member. So our disease management program is follows: ADHD, perinatal substance abuse, perinatal depression, anxieties, diabetes, and heart disease. So as you're working with Nebraska Total Care, we'll be providing an enhanced quality of clinical services within our network. So we will be providing you trainings for behavioral health providers. We'll be providing trainings that also include CEUs. So there's screening assessments, CBERTs, motivational interviewing, discharge and follow-up training and collaboration, identification of care gaps, evidence-based practices, additional supports to providers as needed. Again, we really want to be collaborating with our providers to figure out what the barriers are that you are experiencing so that we can help you serve members better. All of you should have received a contracting and credentialing packet. And so as a reminder, what that packet looked like was there was a welcome letter, a participating provider agreement, marketing pieces, provider data form, and disclosure of ownership. Our model is a willing and robust network with the best possible access for our members. So the components of our agreement also include some standard language, state-mandated language, so those things that are unique to our contract with the state of Nebraska, rate exhibits, and a delegated credentialing agreement for those providers that that's applicable to. So the credentialing elements for practitioner ranges from the provider data form on CAQH, attestation, hospital privileges, work history, licensures, etc. The typical credentialing elements for an organization, again, is that application, that attestation, that proof of accreditation, or CMS audit, liability coverage, sanction checking, licensure, CLIA certificate, EDA certificate. If you have any questions or concerns related to your contract, for both physical health and for behavioral health, Tim Easton is our Director of Contracting, and his contact information is pictured on our slide deck. You're welcome to outreach to him at any time, and he will get back to you. So for provider relations support, again, I am overseeing provider relations for our behavioral health network. Mary Laughlin is our Director of Provider Relations, and she'll be servicing physical health. She has 6 provider relations specialists. I have 2 with an additional coordinator. And so our goal is really to assist the providers in navigating Nebraska Total Care self-care. We will be the face of the organization, working with you closely to address some various questions and concerns. So we provide lead on things like provider education, HEDIS care gaps, financial analysis, and assisting providers with EHR legalization. We can also assist you with demographic information updates. So if you're moving offices or you're adding or turning a provider within your organization, we are able to assist you in doing that within the health plan. We can initiate credentialing on a new practitioner. We can assist you in facilitating inquiries about policies, if you have questions, procedures, or operational issues. We'll also be monitoring performance patterns and providing that information as feedback. Contract clarification, membership, provider roster, and assistance with the provider portal registration and posting. What you should also expect is that we will be responding to your questions. If you call any of our provider relations specialists, we will get back to you within 1 business day of receiving them. We may not necessarily have the solution, but we certainly want to let you know that we've received your call and that we will be working on it. So this is our provider service phone number. It becomes fully functional January 1st, 2017. And so the thing that I want to point out about this is our hours are 7 a.m. until 8 p.m. Central Standard Time. So hopefully that'll work for those of you who get into the office early or who may stay late and have some unusual office hours from time to time. They can address non-routine prior authorization requests, emergency provider and pharmacy issues. They really will be able to help you navigate those questions, and if they aren't able to assist you, they can certainly route you to the appropriate person or department. They're going to provide also a helpline to respond to questions related to, again, physical health, behavioral health, vision, and pharmacy. So that becomes and will be fully staffed locally in Omaha, and they do look forward to working with you. So some additional supports. So Chris Stark is our Vice President of Network Development and Contracting, and his contact information is above. Again, physical health and behavioral health contracting questions and credentialing questions, you're welcome to contact Tim Easton. For Provider Network, Mary Laughlin is our director, and her contact information is there. Again, my name is Monica Johnson, and I am the Behavioral Health Provider Network manager, so I will be assisting those behavioral health providers statewide as well as my staff. And should you have any questions about provider contracting inquiries, you're welcome to email networkmanagement@nebraskatotalcare.com. I know I went fast this morning through a lot of information, so I will be around after the presentation, but we do have another presentation as well. So I'm going to give everybody like a 4-minute break. Will that work for everybody? And then we'll come back. Thank you so much.
Good morning. My name is Amanda Payne, and I'm a Provider Relations Representative for WellCare of Nebraska. I would like to thank you here for having me here today. This is a very exciting time for WellCare as a company to be chosen to be one of the 3 MCOs to participate in Nebraska's new Heritage Health Plan. It is an honor to be working with such an outstanding group of providers and members for the state of Nebraska. Throughout this presentation, you will hear an overview of WellCare of Nebraska, provider resources, billing, member care and quality, compliance, contracting, and credentialing information. I do want to mention that there will be some time at the end of this presentation for questions, so if you would please hold them until the end. I know there's a lot of information being communicated today, and realize you may not have time to digest all of it. But we will be posting today's presentation as well as a pre-recorded orientation very soon to all of our WellCare website. So you'll be able to reference any information that you may have missed today. WellCare is a physician-founded company. We focus exclusively on providing government-sponsored managed healthcare services. We serve 3.7 million members nationwide to help our members live a healthier life. WellCare's vision is to strive to be a leader in government-sponsored healthcare by collaborating with our providers and our members. Our members are our reason for being at WellCare. WellCare of Nebraska is headquartered in Lincoln, Nebraska, and we'll have regional offices with welcome rooms throughout the state. The welcome rooms are open for both the providers and the members. Members and providers may meet with WellCare staff. The welcome rooms are unique in a way that they serve more as a community-based office. You actually don't have to be a WellCare member or provider to use these rooms. For example, a community organization that doesn't have anywhere to host a meeting can use the space at no cost. These offices will be located in Kearney, Norfolk, Omaha, and Scottsbluff. Now that I have given you an overview of WellCare of Nebraska's locations and what our mission is, I want to highlight a few of our provider resources we have available to you. We offer multiple levels of provider support. In addition to our provider relations representatives, we have clinical HEDIS practice advisors on staff, as well as operation account representatives who will be able to assist you with claims issues. They may even be able to process the claim right in your office. We are dedicated to serving your needs. Please reach out to us for any information that you need. We are here to help you. Our provider relations staff would love to meet you in person and have either an orientation or just a meet face-to-face. We are committed to providing provider outreach to keep you informed. You can expect us to consistently communicate. We also have local provider relations representatives that will reach out to you. We would love, again, to come out and meet you in person and do an office orientation for you. For more information on WellCare specifics, you can refer to our provider manual, which can be located on WellCare's website. The provider manual has more detailed information about provider requirements and how to file a grievance and prior authorization information. WellCare's website offers providers numerous resources, from the provider manual to our different resource guidelines. Extensive information can be found on our main website. Here's a screenshot of what our website looks like. You will notice among the options listed is a way to search our provider network and to access our secure provider portal. Once contracted and registered, you can actually access your secured online provider portal. Within this portal, you may verify member eligibility, review authorization requests, and claim statuses. Providers also may access a HEDIS section where they can actually access their quality data. Now for the important part, probably one of the most important topics of the day, billing and payment, right? Everyone here wants to get paid. Claims must be submitted within 180 days. Claims will be processed within 15 days, and daily check runs for both electronic fund transfers and paper. You may submit claims 3 ways. Electronic fund transfers using the Pay ID, direct data exchange, which is using our provider portal to enter direct data on WellCare's website, or by mailing them directly to WellCare of Nebraska's Department of Claims. The address is listed here. Also, please note that if you use a UBO4 or a CMS 1500 red claim form, it cannot be handwritten or replicated. Providers are encouraged to update any demographic changes to ensure claims processing is uninterrupted. If something like an NPI, TIN, or address were to change, please update with us as quickly as possible. Also, please notify the state. WellCare offers both electronic funds transfers and electronic remittance advice. Providers can register with PaySpan Help to participate in either or both of these services at no cost. Your local provider relations representative can assist you with registering and go over all the added benefits of both of these services. Our next section is an overview of eligibility and benefits. Shown here on the screen is our member ID card. Something that I do want to point out to you is we do have a specific WellCare ID number and a Medicaid ID number for our members listed on the claim or on the card. But for claims purposes, I want you to know that either number will be accepted. Just please note that providers are responsible for verifying eligibility prior to any services rendered. At minimum, all benefits and covered services deemed medically necessary that are currently covered by DHHS will still be covered by WellCare. While some services have a copay, please note there are a few exceptions. A few of these exceptions would be members who are 18 or younger, Native American members, pregnant women. Along with all covered benefits, the complete copay listing is outlined in our provider manual. One of the biggest changes to managed Medicaid is that WellCare will now be managing behavioral health services, covering a comprehensive array of both mental and substance abuse services, both community-based services as well as halfway houses. Please keep in mind, members can self-refer and do not need a PCP referral. While emergency behavioral health services do not need an authorization, inpatient admission notification is required on the next business day. Another big change to the Heritage Health Plan is WellCare will now be managing pharmacy benefits. We encourage providers to prescribe off the preferred drug list and prescribe generic drugs when available. WellCare of Nebraska will use the preferred drug list that the state publishes. Please refer to our provider manual for any additional information. Member quality and care. WellCare Utilization Management Program includes review processes such as prior authorization, concurrent and retrospective review for elective and non-emergency services. Providers may request an authorization by fax on the provider portal or by phone for urgent requests. WellCare will not exceed 14 days for standard requests set by the state and is striving for 24 hours for expedited service requests. Providers can access clinical coverage and practice guidelines on WellCare's website. Providers can also utilize the authorization lookup tool by going to WellCare's website and inputting a CPT code. Here is a screenshot of what this lookup tool looks like. Providers may appeal contractual issues or payment issues within 90 days. WellCare has strategic partnerships to ensure highest quality of services are being provided to our members. On the screen is a list of the utilization management partnerships that we have. WellCare is committed to our mission statements. Our members are our reason for being. We complete a health risk assessment for all of our new members to identify any additional care needs. We also have field representatives or field case managers located throughout the state to help providers identify members with additional health needs. WellCare offers disease management programs to members with chronic conditions. WellCare will provide more education to those members about their conditions and help better manage their symptoms. WellCare of Nebraska has a dedicated quality improvement team that offers programs such as quality studies or medical review audits, among a few. Our quality program is an opportunity for us to demonstrate the quality and consistency care that is available to our members. Our next section is compliance. WellCare takes compliance very seriously. All providers in our network are required to comply with WellCare's compliance program. A few of our requirements, but are not limited to, would be provider training, limitation on provider marketing, and our cultural competency program. Our cultural competency program goal is to ensure that WellCare meets the unique, diverse needs of its members. Again, I'm going to go back to our mission statement is our members are our reason for being. WellCare is very big on that. In ordinance, with American with Disabilities Act, participating providers must provide reasonable accommodations to those with disabilities. An example would be waiting room and exam room furniture. Also, please note that these members may require extra assistance and patience. WellCare offers interpreter and sign language services. Please call our customer service line to assist in obtaining these services. The interpreter services include verbal translation, verbal interpretation, and sign language. Additionally, written material can be obtained in large print. A big piece of our compliance program is the fraud, waste, and abuse. Fraud is an intentional deception made by someone with the knowledge that the act will result in a benefit. Abuse is something inconsistent with the accepted industry standards, resulting in unnecessary costs. And waste is anything that would result in an unnecessary use of financial resources. WellCare has created a special investigations unit to investigate cases of fraud, waste, and abuse. We work with the state of Nebraska, and we are responsible for the detection, prevention, and correction of these cases. The Special Investigations Unit reports the following: improper billing practice, claims not medically necessary, and failure to maintain adequate records. Refusal to furnish these records are just a few behaviors that are reported. Our last section this morning is contracting and credentialing. Contract packets have been mailed to Medicaid providers across the state. These packets, you will find the agreement to join our provider network, as well as a WellCare health plan sheet. Information to aid in completing the contract. We are able to assist you with any questions that you may have during your contracting process. Once contracted, the next step for our providers is to complete the credentialing process. WellCare follows specific credentialing processes and corresponds criteria set forth by the NCQA. A common question that we have been hearing from our providers across the state is, when will we be effective? For providers that are contracting before the end of 2016, your effective date will be January 1st of 2017. If you contract after 1/1 of 2017, your effective date would be the first day of the following month. Providers will receive a welcome letter with a provider ID number. Provided on the screen here today is a list of important contacts. I want to thank you very much for your time today, as I realize your time is very valuable. I know we've covered a lot of information today. Please do not hesitate to reach out and speak with any one of the WellCare representatives here today with any questions you may have. I want to leave you with this. We are very excited as a company to be in Nebraska, but we do know that there may be some obstacles along the way. WellCare is committed to you as providers to work through those obstacles to make this transition as smooth as possible. Again, I want to thank you today for all your time. And if you did not receive one of our packets, we do actually have those available.